Hi, Dr. Shmaila here. Today we continue with chapter number 5, part 2, that is active movement, our learning objectives. What is resistance exercise, principle of resistance, techniques and type of resistance, effect and uses will also be discussed in detail. Further discussion on that is progressive resistance exercise. Power methods of progression of resistance will also be discussed. Then involuntary movements along with effect and uses of the flex movements will also be discussed in detail. Resisted exercise. Resisted exercise is any form of the active exercise in which the dynamic or static muscle contraction is resisted by an outside force applied manually or mechanically. Load or resistance is given to a muscle to increase muscle performance. Muscle performance means strength, endurance, and power. What is the principle of resistance? Basically, resistance means opposing force. An external force may be applied to the body levers to oppose the force of muscle contraction. Tension in these muscles is increased with the muscles by the opposing force, or we can say resistance, and the muscle responds by increase in their power and hypertrophy. As the increase in the muscle development occurs in response to the increase in intramuscular tension, it follows that application of the maximum resistance, which is consistent with the ability of the muscle to overcome it, will elicit the maximum development. When applying resistance, the power of the muscle must always be greater than the resisting force in order to allow the contraction and controlled movement to take place. When the muscle power and resisting force are equal, maximum tension is created in the muscles but no movement results. But if the resisting force exceeds the power of contracting muscle to which is opposed, it will force the muscle to elongate at a speed which is beyond their control. This may injure the muscles or the joint and to be avoided. Look at these points. Whenever we apply resistance, then power of muscle must always be greater than the resisting force. And when the muscle power and resisting force are equal, then we can say maximum tension is created in the muscles but no movement results. But if the resisting force exceeds the power of the contracting muscle, it will force the muscle to elongate at a speed which is beyond their control, and this is very injurious to the muscle or the joint and must to be avoided. There are five factors which contribute to the development of muscular efficiency, that are power, endurance, volume, speed of contraction, and coordination. Power develops in response to the application of the maximum resistance, which is consistent with the ability of the muscles to overcome it. Therefore, the power can be built up when they work against a progressively increasing resistance. As the essential factor in power development is the magnitude of the resistance, the method used to promote is called heavy resistance low repetition exercise. Means number of times the movement is repeated being relatively few to allow the resistance to be as great as possible. Means heavy resistance low repetition exercise. Endurance is the quality which develops in response to repeated contraction. Therefore, at is number of contractions, which is the essential factor. The method used in this case is basically called light resistance high repetition exercise. Volume, which can be observed or measured as an indication of hypertrophy, usually develop in proportion to power. It serves as a means of demonstrating progress to the patient, although it is not maybe a reliable indication of successful treatment. Skill in estimating the capacity of the muscles at every stage of the treatment in matching this with the correct amount of resistance is the keynote to success in the use of the resisted exercise. Variation of the power of the muscles in different parts of their range. Muscles which are capable of producing a considerable range of joint movement are not equally powerful in all parts of their range. Physiologically, Muscles are capable of exerting their greatest strength when they are fully extended, for example, in the outer range. As they shorten, their force diminishes. This, however, is modified in the case of some muscles by mechanical factors such as the angle of pull of the tendon of insertion. That is, effect of the pull on the liver is greatest when the angle of a pull approaches to the right angle. For example, physiologically, Physiologically, we can say the flexes of the finger strongest in the outer range, but mechanically strongest at about mid range. When both these factors are taken into account, and allowance is made for overcoming the initial inertia at the beginning of the movement, so it is roughly estimated that muscle will be most efficient in the outer part of the middle range. Thus, this in fact can be proved by the experiment. It seems, however, that relative importance of these factors varies in different power muscle groups, but broadly speaking, each group is found to be more force powerful in the part of the range in which it is habitually used. For example, we can say shoulder flexors in the outer range and hip extensors in the inner range. They are most used habitually. In giving manual resistance, these variations in the power can be felt and resistance adjusted accordingly, but other means of providing resistance are not so accurate from this point of view. Now, what is the technique of resisted exercise? First of all, starting position. A suitable starting position is selected. Comfort and stability for the body as a whole ensures that a patient's whole attention can be concentrated on the pattern of the movement and therefore required to overcome resistance. Pattern of movement, this must be well known by the patient and can be taught as a pre-exercise. The pattern selected should whenever possible be one which allows the contraction of the muscles in full range and should be based on a natural pattern of the purposeful movement. Stabilization. Stabilization of the bones or bones of the region of the muscle to be resisted improves their efficiency. Stabilization is really static. When a natural pattern of movement is used, it is constantly being adapted to the circumstances of the movement. Provided the muscles normally responsible for the stabilizations have remained efficient, they will be used for this purpose as their action is considered to provide reinforcement for the muscles producing the movement. If, however, there is a tendency for the movement to be transferred to the neighboring joint so that movement of pattern is altered, then additional means of fixation such as manual pressure or stab must be applied to ensure movement at the required joint. Otherwise, stabilization is more than enough. Traction. Preliminary stretching of the muscle to elicit myostatic reflex provides a powerful stimulus to contraction and traction maintained throughout the range. Facilitates joint movement and maintain tension in the muscle, so augment the effect of the resisting force. What is the resisting force? A variety of the means may be employed to supply the force used to resist the contraction of the working muscle, for example, manual pressure, weight, and springs, etc. But in every case, it should be applied in a manner which ensures that pressure is exerted on the surface of the patient's skin, which is in the direction of the movement. What is the advantage of manual pressure? Manual pressure advantage of manual pressure is that it can be adjusted accurately to match the power of the muscles in all circumstances in every part of the range. But it also has the disadvantage of not being easily measurable. Mechanical resistances are usually measurable and therefore provide a useful means of recording progress. The magnitude of resisting force in relation to the that of muscle power varies according to the purpose for example which it is choose. Maximum resistance elicits maximum effort on the part of the muscle and it is therefore used to develop power and hypertrophy. As the quality of the muscle endurance is developed, repeated contraction against resistance, basically endurance is considerably less than the maximal to allow a greater number of repetitions to take place. Character of the movement. The movement is essentially smooth and controlled throughout, effort being involved commanding the patient's full attention. Speed of movement is consistent with the optimum rate of contraction for the particular group of the muscles in relation to the resistance which constitutes the load. The range of movement is full whenever possible, but resistance can be applied in any part of the range which is considerable or desirable, and the muscle can also be resisted so that they work statically at an particular point in their range. Repetition means repetition means number of times the muscles are thrown into action against a resistance varies according to the condition of individual patients and is inadvisable to accept any rule of the thumb procedure. Basically, when we talk about repetition, then we can say there are two important points. First, to low resistance, high repetition exercise appear to be more suitable for weak or elderly patients whose muscles are less resilient than those of the young and strong, and they have proved to be effective in such conditions. For example, osteoarthritis. High resistance, low repetition exercise, on the other hand, built up a power and hypertrophy muscle suffering from the disuse as a result of the traumatic injury or the connection with orthopedic surgery, for example, meniscectomy. And when there is fear or joint changes are present, for example, rheumatoid arthritis, then we can say static resisted contraction of the muscles passing over the joint with a high repetition figure are valuable for turning muscular efficiency, and they can be performed in any part of the range which is pain free. The number of repetition may also be determined by the desirability of or the indication to fatiguing the neuromuscular mechanism in the treatment of a specific condition. Cooperation of the patient. The effort exerted by the patient and his interest in the treatment undoubtedly play an important role in the development of his muscle by means of resisted exercise. Inertia interest is stimulated by a patient in applying the resistance, regular measurement and recording of the progress, verbal encouragement, and in suitable cases by competition. Look at this picture. This is basically grading of osteoarthritis. Osteoarthritis, first of all, you can say that there is almost 10% cartilage loss in stage 1, minimal disruption basically. In stage 2, we can say the joint space narrowing, then cartilage begins breaking down, and basically occurrence of osteophytes. When stage 3, then there is moderate joint space reduction, and gaps in the cartilage can expand until they reach the bone. Stage 4, in stage 4 joint space greatly reduced, 60% of the cartilage is already lost. Large osteophytes. This is healthy knee joint structure, and this is osteoarthritis. Look at this picture. Basically, this is normal joint osteoarthritis where joint space narrowing, and this is rheumatoid arthritis, basically swollen inflamed synovial membrane, bony erosions. Rheumatoid arthritis symptoms to never ignore. Basically, if we look at here, then rheumatoid arthritis, basically you can see there dis, disrupted sleep, low-grade fever, fatigue, and then dry eyes and mouth, weight loss, joint pain, swelling, stiffness, pain of a start in the fingers and toes and spread to the other joints, and joints look red and discolored, or pain in the big toe, numbness and tingling in the hands and feet. Further, the joint feel warm to the touch. These are typical symptom of rheumatoid arthritis. No, resistances. Resisting force other than that provided by the gravity and friction may be provided by a physiotherapist. Patient wears weight and pulley circuits, springs, and other elastic structure, substances which are malleable, and then water. Now we discuss these type of resistances. First of all, resistance by physiotherapist. This is usually applied manually in the line of the movement. Proprioceptive stimulation facilitates the patient effort to overcome the resistance when the physiotherapist's hand is placed on the surface of the skin, which is in the direction of the movement, to prevent waste of effort and to ensure smooth, controlled pressure. The physiotherapist's stance must be in the line of the movement so that the thrusting action of the legs and body weight are utilized. Traction may be maintained throughout the movement, and resistance varies according to the variation in different parts of the muscles range, but it cannot be measured accurately or recorded. What is proprioception? Basically, perception and awareness of the position and movement of the body is called proprioception. What is the advantage of manual resistance or resistance by physiotherapists? The resistance can be varied with changes in strength production throughout the range. When joint motion is allowed, manual resistance exercise offer an easy, inexpensive method of strengthening muscles. Specific or individual muscles could be strengthened. Disadvantage: the amount of resistance depends upon the therapist's condition. The resistance cannot be measured, so the treatment result cannot be documented. So, effort and time consuming, as a therapist can treat only one patient at a time. Now, what is the resistance by patient? The patient can resist his own movements with the sound limb or by tensing the muscles antagonistic to those which attempt to produce the movement. For example, by using his own body weight. The latter method is probably more accurately classified as a free exercise, but included here as the quantity of resistance is obviously much greater when, as in the case, the muscle work with the reverse origin insertion to move the trunk on the limbs. This type of resistance is convenient but tend to be unreliable as it cannot be measured or felt by the physiotherapist, and it requires careful instruction and cooperation and understanding of the patient. Example: from high sitting, the extensors of the knee can be resisted by weight and pressure of the other leg when applied ankles are closed. Similarly, flexors of the elbow can be thrown into strong contraction by bracing all the muscles of the arm. The body can be pressed up from the floor by the arms if their strength is sufficient. Resistance by weight. The direct application of the weights to the body forms a simple and effective method of resisted exercise. Apparatus required is basically commonly sandbags, metal weights, or a medicine ball, which can be applied by being held in the hand, by attachment to a shoe, or by to any other part, or by suitable straps. When sandbags or metal weight are used, a canvas bag may be strapped to the part and any number of units of the weight can be inserted to provide the required resistance. It is essential that means of attachment should be comfortable and efficient. By this method, resistance must of necessity be given in the direction of the gravity. Its effect increases progressively if the weight is moved away from the central axis of the body. It is convenient method and suitable for home practice after adequate instruction has been given. For example, lifting a weight held in the hand or attached to the foot or throwing a medicine ball are common examples. Resistance by weight is also commonly used for the technique known as heavy resistance exercise. Now discuss what is heavy resistance exercise. Basically, the use of heavy resistance exercise for the restoration of the muscle power and the volume after injury was first described by D. Lorme in 1945. Metal weights, which constitute the resisting force, are applied to the part of the body in question either by means of barbell held in the hands or D. Lorme boot. You called it as quadricep or some similar device. The poundage is determined by testing the repetition maximum for a given number of repetitions. Lifting the weight may involve either static or dynamic muscle work according to the circumstances, and the movement is slow and controlled. Several ways of correlating the weight lifted and number of repetitions have been used. It appears that regime most suitable and successful in the treatment of an individual patient varies very much with the age, temperament, and the condition from which it is suffering. It is essential that his instruction is precise and that his efforts are well supervised. The following schemes are in common use and form a basis for experiment. They are based on 10 repetition maximum, and basically they all represent power program. Empirical measures can be replaced by metric unit. Look at these examples. Delorme and Watkins says that 10 lifts with 1 by 2 10 repetition maximum, 10 lifts with 3 by 4 10 repetition maximum, 10 lifts with 10 repetition maximum means 30 lifts 4 times weekly, progress 10 repetition maximum once weekly. Similarly, Zinove Oxford technique says that 10 repetition 10 lifts with 10 repetition maximum, 10 lifts with 10 repetition maximum minus lbs, and basically 10 lifts with 10 repetition minus 2 lbs, then 3 lbs, then 4, then 5, then 6, then 7, then 8, 9 lbs means 100 lifts 5 times weekly, progress 10 repetition maximum daily. McQueen says 10 lifts with 10 repetition maximum, 10 lifts with 10 repetition maximum, 10 lifts with 10 repetition maximum means 40 lifts 3 times weekly, progress 10 repetition maximum every 1 to 2 weeks. Delorme method based on repetition maximum of 10 and designed for early rehabilitation, designed for beginning rehabilitation, introduce pre-progressive loading, builds in warm-up period, and 50%, 75% and 100% of the 10 repetition maximum are used. 1 by 2 means 50%, 3 by 4 means 75%. Oxford technique says used during early, intermediate and advanced levels of rehabilitation. Percentages of 10 repetition maximum diminish resistances as muscle fatigues. 10 100%, 75%, 50% of the 10 repetition maximum. Most important techniques from paper point of view. Endurance program is based on the use of relatively low resistance, high repetition regime. Heavy resistance exercise can be used in the principle for the development of most muscle groups, but it is at present more often used for the knee extensors than any other muscle group. Resistance by weight and pulley circuit. Basically, the use of pulley and rope allows the force exerted by the weight to act in any direction. Therefore, the muscles need not be required to work against the resistance of both gravity and weight. The effect of gravity can be counterbalanced if the movement takes place in a horizontal plane. This provides a useful methods of arranging resistance for weak muscles when the limb is heavy. For example, took an example. In sitting, resistance of gravity to the knee extensor is approximately 10 lbs. If these muscles are unable to straighten the knee against the resistance, they are still able to perform this exercise when inside lying. Leg is supported horizontally and resistance of perhaps 8 lbs applied in this case. As the angle of pull of the rope by which it is applied and both the resistance itself must vary during the course of movement, a resistance can be offered to the muscles which matches the variation of their power in different part of the range more accurately than that supplied by means of a weight applied directly to the part or by the springs. For example, a particular muscle grows more powerful in mid-range. It is there that resistance is applied at right angle. Both the power of the muscles and force of resistance will diminish on either side of this point. To ensure relaxation and lack of strain on the joints between the movements, a relaxation knot is incorporated on the circuit by means of a clip or a knot which prevents the rope from being passing the pulley or by arranging for the weight to be supported at the end of the movement. Psychologically, it is great importance for the patient to is able to see the weight moving as a result of his work and to know and record the poundage lifted. This is very helpful for the patient psychologically. Now, resistance by springs and other elastic substances. The resistive force of a spring increases progressively as it is stretched or compressed according to the type of the spring used. Although convenient to arrange, the use of the springs for resisting muscle contraction must be regarded as a somewhat crude method as it is virtually impossible to match the resistance to capacity of the muscles with regard to the both power and range of movement. When springs are used, then, the speed of movement must be carefully controlled by the muscles both in contraction and during controlled relaxation, as accumulated energy in an extended spring made its natural speed of the recoil very great. Other extensible materials such as rubber elastic of various widths and thickness behave in a manner similar to that of the spring, but they are not so durable. The elastic properties of the servo rubber are apparent on the pressure and rubber sponges, Dunlopillo, and rubber balls afford bearing resistances, which are particularly useful in developing the gripping muscles of hand. These are very helpful to improve the gripping activity of the hand. Resistance by substances which are malleable. Substances such as putty, clay, some kinds of the wax, plasticine, and wet sand can be molded into different shapes. The resistance they offer to this change in the form is variable and can be used both for strengthening or for mobilizing the hands. Resistance by water. The resistance offered by water increases with the speed and surface area of the part moved. When the movement is vertical, buoyancy adds to the resistance on the way down and cancel out much of the resistance on the way up. Progression. As the power of the muscle increases, the tension produced by the resistance, which is constant, will diminish. Therefore, to maintain the stimulus of tension, the resistance must be increased proportionally as the power of the muscle develops. There are basically four main methods of increasing the resistance to the muscle action. Each method may be used singly or in combination with any other method. First method, increasing the poundage or weight of the resisting force. Second, increasing the leverage of the resisting force. Third, alteration in the speed of movement. And fourth, increase in the duration of the exercise. First, increase in the poundage or weight. For example, it is found that a muscle group able to achieve the full range contraction against a weight of 3 lbs when it is applied at a specific point can contract at specific speed and for specific duration. As the muscle power increases, the weight is increased proportionally. For example, 3 lb to 4 lbs, then 5 lbs, then 6 lbs, while other conditions remain constant. The actual amount of the increase is variable according to the particular muscle group, its rate of progress to the recovery, and frequency at which an increase is made. Increase in the leverage. The total resistance offered by a given weight depends upon the position of its point of application in relation to the fulcrum. Moment of the force is equal to weight into perpendicular distance from the fulcrum. So, greater the perpendicular distance of the point of the application from the fulcrum, the joint at which movement takes place, the greater the resistance offered by the weight. For example, a manual resistance which is relatively constant given to the shoulder abductors with the arm straight is much greater when applied at wrist than at the elbow. And when we apply the resistance at the level of elbow joint, then basically it is used for patient with weak muscles, for example shoulder abductor weakness. Alteration in the speed of movement. Muscle contraction is more efficient when it takes place at an optimal or natural speed. This speed varies according to the form and structure of the muscle concerned, the resistances, and the individual. Increase or decrease in the natural speed of the contraction increases the effort of the resistance when the muscle works concentrically, but when it works eccentrically, then slower the movement, the greater the effect of the resistance. Concentric work is essential easiest at natural speed and eccentric work at high speed. For example, it is easy to climb a steep hill at your own speed than it one dictated by a companion who may prefer to go faster or slower than you do, but it is easier to calm down. Increase in the duration. As the muscle warm up to the task of overcoming a resistance, they become more efficient and therefore the effect of the resistance therefore decreases and exercise seems easier. If overeating is continued a sufficient number of times, fatigue reduces the efficiency of muscles and resistance therefore appears greater. For example, sawing a log of wood may seem to become easier as you warm up to it, but it becomes hard work by the end of an hour. Now, what are the effects and uses of resisted exercise? First, muscle power can only be maintained or engaged by the contraction, and these exercise working muscles are strengthened and hypertrophied in response to the tension created in them by the resistance. Their power and endurance is increased. So we can say resisted exercise are used to build up weak muscles and to so restore the balance of the muscle power, which is essential for stability and coordinated movement. When all the muscles are weak, so we can say power and functions are improved. Second, blood flow to the working muscle is increased in proportion to the amount of the work they are called upon to do this, providing the materials for repair and hypertrophy. Although the flow is impeded during the act of contraction, the amount of blood contained in the muscles immediately after contraction may be as much as 10 times as great during strenuous exercise as the amount contained during rest. This increase in the blood flow to the muscles continues for some time after exercise, bringing oxygen and nutrient to the part and assisting the removal of the waste products. Third, a generalizing blood pressure frequently anticipates exercise and may be increased by the mental effort required to perform these exercises correctly. Heat, which is produced as a result of strenuous muscle activity, stimulates the heat regulating center, causing vasodilatation in the skin. This follows a constriction of these vessels, which occurs in the first place to compensate for the increase in blood flow to the muscles. It has been if there has been sufficient exercise, the skin feels warm and possibly moist, and though appear pink, indicating that heat is being lost from the surface to balance the gain from the muscle activity and so keep the body temperature within the normal limits. The degree of the moisture depends largely on the temperature, humidity, and movement of the atmosphere. Now, come towards involuntary movement. You can say movements are classified in two types, involuntary and voluntary. Voluntary movements, as discussed previously, and involuntary movement. Now, discuss involuntary movement. Reflex movement. Involuntary movement is basically not under one conscious control. It is basically reflex movement. Reflex movement is basically involuntary and may be defined as motor response to sense stimulation. These reflex movements are protective in character, are concerned with repetition of the movement pattern which have become automatic or habitual. Although the stimulus which give rise to the reflex movement don't really gain conscious recognition, the patient is aware that reflex movements of the body have taken place. Reflex movements, which are always involuntary, occur in response to sensory stimulation, which is transferred to the muscles without the knowledge of the cerebral cortex, as the coordinating center is situated at some lower level, which is of the central nervous system. Knowledge of the movement only reaches consciousness after the muscle contraction has been initiated. Basically, there are two types of reflexes: flexor reflex and extensor reflex. Flexor reflex basically reflexes which arise from the painful stimuli are mostly flexor in character, their purpose being to protect the body from the harm. For example, withdraw of a hand on touching a hot iron or a foot on stepping on a nail. Extensor reflex, basically these are weaker than flexor reflex and easily give way to them if the pain is experienced. They are mostly demonstrated in the leg where they involve the use of the anti-gravity muscles and elicited by the firm pressure on the foot when the leg is bent. What is reflex arc? Reflex arc is a pathway of impulses which give rise to the reflex activity. In a more simple form, it consists of the two neurons, an afferent which leads from the sensory receptor organ to the CNS, and an efferent neuron leading from the CNS to the effector organ, that is muscle. Pure reflex arcs are as simple as this. Most of them consisting of a chains of neurons in which one or several connecting neurons lie between the afferent and efferent neurons. Flex activity can be stimulated and used to improve facilitate movement and maintenance of the posture. Now, what is myostatic or stretch reflex? Basically, this is a spinal reflex activated by stretching a muscle. When an innervative muscle is stretched, it responds by contracting and developing tension to counteract the stretching force. This provides a means of promoting activity in muscles when voluntary effort is ineffective or too weak to do so. Basically, quick stretching stimulates the muscle spindles when they are, which are perceptive receptors so that they discharge impulses reach the anti-horn cells by monosynaptic pathways. Tension in the contact muscles is increased by the application of resisting force, and we can say quality of the contraction is improved. Quality of the contraction of the muscle in response to stretch is accompanied by the reciprocal inhibition of the antagonistic muscles to permit movement. Look at this diagram. Tendon trap causes your muscles to stretch, and then response come to the body, and the result is contraction of the muscles. Because of the excitability of the motor neurons. Muscle spindles are stretch receptors within the body of the muscles that primarily track changes in the length of the muscles. They convey length information to the central nervous system by afferent nerve pathways. No, reflexes, writing reflex. These are the series of reflexes concerned with the maintenance and restoration of the equilibrium. Pushing the patient off the balance elicits a series of mass movements designed to restore balance and save him from falling. Posture reflexes. The erect posture is maintained by the complex series of reflexes known collectively as posture reflexes. These two groups of the posture reflexes, writing reflexes and equilibrium reactions. Now come to effect and uses of reflex movement. Basically, the initiation of reflex movements provide a means of promoting activity of the muscular mechanism when the voluntary effort is ineffective or insufficient for this purpose. So we can say it is used in the case of the flaccid paralysis and brain damage to facilitate the initiation of movement and to combat the effect of grave inactivity. Normal joint movement and its sensibility of the muscle is maintained by this type of the movements when the spastic muscles make voluntary movements impossible. Circulation is improved by the contraction of the muscles and movement of the joint achieved during this movement. Temporary relaxation of the spastic muscle is obtained following repeated movements of this type by means of the reciprocal innervation. This may provide the opportunity for the development of the voluntary ability to perform movement in case of the spastic paralysis. Posture reflexes are conditioned to reproduce a satisfactory pattern of posture by repeated use of these methods. This is the basis of posture re-education. Most important question from the paper point of view at effect and uses of reflex movement. Thank you. This is end of the chapter number 5, that is active movement. Hopefully you like it. Thank you again.